The race for COVID-19 continues throughout the world. Everybody is working hand in hand to combat this invisible enemy we call the coronavirus. No country can do it alone. Breakthroughs in science have pushed the invention of the vaccine that can take up to 10 years down to 300 days.
The world's rests on the shoulders of scientists, and over the last year, like countless times before, they have risen to the challenge.
Now, across the way in the UK, they are trying to break down the current 300 days that are rolling out the vaccine over the planned 300 days, rather, down to just 100 days in order to supply affordable and effective vaccines around the world. Now, to dive deeper into this matter, we have online with us the British ambassador to Indonesia and Timor Leste, Mr. Owen Jenkins. Good afternoon, Mr. Jenkins.
Good afternoon, Paul. How are you?
I'm doing great. Thank you for joining us here on the 3-Hour News Show. Could you give us the latest update on the situation right now in the UK? We know that there was the B117 strain that originated, or was first discovered there, rather. And how is the situation now?
So, I mean, as you said, right from the start, we've known that the solution to the COVID-19 pandemic is through science. That, as you say, we stand on the shoulders of scientists. So we've thrown all of the strength of the UK's scientific prowess at this problem. And I'm really proud that over a quarter of the global projects on COVID-19 are happening in the UK, over 1,860 projects, not just on vaccines, but on treatments and on social and other aspects of the disease. That said, we've been hit hard, and as you say, it's been a really hard road for everybody. I think all countries, all governments have suffered, but the scientific process, the scientific work that we're doing is beginning to show results.
Indeed.
One of those is obviously the Oxford AstraZeneca vaccine, which has come out as one of the cheapest, most effective, and most easily distributed vaccines, which are emerging around the world. It's by far the cheapest vaccine. It's about $4 a dose compared to about $10 a dose for the next cheapest, and it can be distributed and used easily. And we're very conscious that in doing all this scientific work, we need to make everybody safe. This is not just something the UK can do alone, Indonesia can do alone, or any country will succeed on their own. We're not safe until the pandemic is under control in every country. We're working on that in the UK, and we're really proud of our vaccination program, but we're also really proud of the international effort that we're making to try to get vaccines and treatments out around the world to everybody.
Thank you for the latest update, Mr. Owen. And what is actually the best practice from the UK and Indonesia in its inoculation practice that you can see be shared around the world?
So I think the Indonesian government is doing a fantastic job here, and the segment you just shown on bringing in online services, having innovative drive-through inoculations and so on is fantastic practice, and I think the UK can learn from Indonesia as well as the other way around. I think what we learned early on was that we needed to invest heavily in vaccine procurement, as Indonesia has done, and we need to gear up our National Health Service to make sure that when we have the supply, the vaccines can roll out across the country. And we're very proud of the success of the UK in doing that. We've vaccinated around 21 million people so far in Britain, which is about 31% of our total population. So we are learning that it can be done. And because we've focused on the oldest and the most vulnerable people first, we've really succeeded in driving down hospitalizations and deaths as well. And I think the approach that Indonesia is taking, which is to focus on the older people to make sure that vaccines can roll out at speed through the fantastic system of Puskesmas and the national health system in that context, is really effective. And if we can learn from each other, I think that will be a really positive experience in these incredibly difficult times.
Yeah, we do understand that Indonesia is trying really hard to keep up with the vaccination programs that are rolling out up until now. But we got the latest update from the UK that the Prime Minister Boris Johnson is targeting down to 100 days to make the vaccines available out of the normal one, which were 300 days. Now, could you give us the latest update on that?
Sure. Well, our Prime Minister likes to set really stretching targets, and I think this is one, but it's one which we're really keen to achieve. And as you said earlier, to get where we are today, to have had a number of vaccines rolling out after only 300 days is already an incredible achievement. Vaccine development and proving often takes sort of 5 or 8 years pre-pandemic. But we're conscious that the damage that the world has suffered from COVID-19 is already too much. Obviously the deaths, the social impacts, the health impacts, and the economic damage from just 1 year in the sorts of measures that we've seen is excessive. So our Prime Minister is determined to bring down even that 300 days to 100 days. He made that announcement as part of our chairmanship of the Group of Seven, the G7 group of nations, and challenged his colleagues there, the other leaders of those countries, to help us drive that down, to work through our shared multilateral organizations, the World Health Organization, the UN, and others, to work with industry and, of course, scientists, to apply what we've learned, to apply the lessons of accelerating vaccine development, vaccine testing, and production into that much more compressed timetable. It will be a huge challenge, but if we can do it, and I think we can, it will not only help with this pandemic, it will help prevent future pandemics and prevent the tragic deaths and the damage that we've seen from COVID-19 when we next face a pandemic, and we will.
Right, Mr. Jenkins, obviously it is a tight target, but indeed off to a good start already. And speaking about the Prime Minister, Mr. Johnson's public approval has certainly turned around. We've seen how this last couple of months have really made the UK become the envy of its European neighbors in regards to the quick procurement and approval of the Pfizer and Oxford AstraZeneca vaccine. Could you tell us a little bit about the story behind how the vaccination rollout became so successful in comparison to other countries around the world, and how effective Oxford AstraZeneca is, because I have read somewhere that it's even more effective in some ways than Pfizer when it comes to hospitalization rates for the coronavirus that's what we're up against right now.
No, that's right, and thank you for those positive words. I think first thing to say is this isn't a competition. That the UK's investment in vaccines and our determination to see that happen was not just for the UK. We know that we can't do this alone, and the vaccines will only be successful and will only protect the UK if everybody is safe. So in terms of what we did right in this context, I think the British government realised very quickly that vaccines were going to be the way out of this, and we were very lucky to have an incredible world-class scientific infrastructure to draw on. So we invested very early in the basic scientific research, in the projects across different universities in the UK, in the manufacturing capabilities, and in partnerships with the drug companies to make sure that when we had vaccines which were viable, they could be scaled up quickly. And that meant taking quite a lot of risk, that we knew that quite a lot of the investments we made wouldn't pay off because normally vaccine candidates don't go successfully through to production. So we knew that we had to invest at risk, and we did that at speed, investing in a whole portfolio of vaccine candidates. The second thing that I think we did, which was important, was to prepare our health service for doing this. We have a fantastic national health service in the UK. It's one of the prides of the country. And so we made sure that our doctors, our nurses, our other health professionals were as well set up as they could be to roll out the vaccines when they were ready. And we employed other bits of the British state. We employed the army to do logistics. And we've, of course, done a lot of media and messaging work to make sure that people are aware of the benefits of these vaccinations. And you're quite right, part of that story is about the real success of the Oxford AstraZeneca vaccine. It's turned out, as you said, to be even more effective than we hoped. In various studies recently, since it started rolling out, it's proven to be over 81% effective. It's really driven down transmission, so people who are vaccinated 67% of the time don't pass on the disease. And as you say, it's really driven down hospitalizations and deaths. We're seeing a 75% reduction already in hospitalizations and a real reduction in deaths as well. So it's proven to be a real triumph of British science. I'm really proud of the team at Oxford and in AstraZeneca for taking it to scale so quickly.
Yeah, and we could see it paying off already. And by the way, one of the first people that I knew of that got the vaccine, I believe you know, one of my coworkers here, Marissa, her mom-in-law was one of the first, as an elderly living in the UK, got her first jab. One of the first cases that I heard of somebody that I knew getting it.
Wow, that's good. And I think a lot of expectations are going beyond of what we planned before. Mr. Ambassador, please don't go anywhere because we're going to continue our interview after the break, especially about the vaccine sharing from the UK to other countries, especially Indonesia.
All right, when we return, we're going to continue our conversation with Mr. Owen Jenkins on the surplus distribution of the COVID-19 vaccine.
Stay with us here on 3 Hour News Show on See Today.